The lecture today we will continue with the seizure and epilepsy, and you will go taking the causes of epilepsy, the differential diagnosis, and treatment of seizure and epilepsy. The causes of focal seizure are that there is no focal structural lesion in the brain, such as called idiopathic, such as benign Rolandic epilepsy of childhood and benign occipital epilepsy of childhood, or there is a structural lesion in the brain. Structural lesions are caused by genetics such as tuberous sclerosis, autosomal dominant frontal lobe epilepsy, autosomal dominant partial epilepsy with auditory features, von Hippel-Lindau disease, neurofibromatosis, and cerebral migration abnormalities. Other focal structural lesions such as infantile hemiplegia and other type of cerebral birth injury, hydrocephalus, cerebral anoxia, mesial temporal sclerosis. Cerebrovascular disease can focal structural lesions such as intracerebral hemorrhage, infarction, arteriovenous malformation, and cavernous hemangioma. Tumors, primarily or secondary trauma, including neurosurgery. Stroke, as in ischemia seen in this imaging, and hemorrhage in this image. Or subdural hematoma and epidural hematoma. AVM in this image. And brain tumor as seen by this imaging. Infection can causing focal structural lesion in the cortex, resulting in focal type seizures such as meningitis, encephalitis, cerebral abscess, toxoplasmosis, cysticercosis, tuberculoma, and subdural empyema and HIV. Inflammatory disease also may resulting in seizure such as multiple sclerosis, SLE, sarcoidosis, and vasculitis. We have an example for brain abscess as in this image and encephalitis and this MRI. Tuberculoma, this is multiple tuberculoma and multiple tuberculosis and HIV in form of an MRI finding. And this is the multiple sclerosis and different types. Generalized seizure cause such inborn error of metabolism, storage disease, phacomatoses, cerebral birth injury, hydrocephalus, and cerebral anoxia. Commonly used, many drugs can induce seizures such as antibiotic, cardiac antiarrhythmic, antipsychotic medication, amphetamine will induce seizure. Other causes of generalized tonic-clonic seizure include alcohol, particularly withdrawal, toxin, and metabolic disease such as hypocalcemia, hyponatremia, hypomagnesemia, hypoglycemia, renal and liver failure. Infection can be complicated by generalized seizures, mainly in encephalitis and meningitis. Multiple sclerosis and SLE can causing also generalized seizure. Diffuse generative disease, particularly Alzheimer's disease, are presented with generalized seizure. The causes that contribute to seizure can be different according to the age group, such as in neonatal, the main causes of seizure including birth injury, anoxia, and metabolic disorder, while in infancy, the main cause are infantile spasm, West syndrome, and congenital malformation. Early childhood, the main seizure types are febrile convulsion and infantile spasm, while late childhood caused by infection, Lennox-Gastaut syndrome, and idiopathic as Rolandic epilepsy. In adolescent, the main type of epilepsy is idiopathic and juvenile myoclonic epilepsy and other causes related to trauma and drugs. While in early adulthood, the main cause are idiopathic epilepsy, trauma, neoplasm, and withdrawal from alcohol or sedative drug. Middle age, the main cause of seizure are trauma, neoplasm, vascular disease, and alcohol or drug withdrawal. While the late life cause of seizure are vascular disease, degenerative disease, tumor, abscess, and trauma. The first step to approach the patient with is determine whether the episode is seizure or not. The differential diagnoses of seizure are syncopal attack, breath-holding attack, pseudo seizure, migraine, transient ischemic attack, and paroxysmal attacks. We have an example of syncopal attack. Syncope or fainting is a temporary loss of consciousness related to insufficient blood flow to the brain. Typically happens while patient standing and often preceded by lightheadedness, sweating, pale skin, blurred vision, nausea, vomiting, and feeling warm. The patient rapidly loses his tone and consciousness for short duration, associated only with short episode of muscle twitching followed by spontaneous recovery. Paroxysmal attacks are usually associated with multiple sclerosis and manifested as sudden recurrence or intensification of previous symptoms, such as spasm, dysarthria, ataxia, numbness, and hemiparesis. Typically, they are stereotyped, lasting less than 2 minutes, frequently recurrent during the day, and increased by shower and hot weather. Breath-holding spells are the occurrence of episodic apnea in children aged between 6 to 18 months and usually precipitated by anger or frustration. The child cries and holding with forced expiration, leading to cyanosis, loss of muscle tone, and consciousness. The child usually fell to asleep and recover within a few minutes. Pseudo-seizure tend to occur in presence of other people, doesn't occur when the person is alone. It is precipitated by emotional factor and prolonged for many minutes or hours. The movements are completely asynchronous in form of thrusting of the limb and repeated side-to-side movement of the head. It mainly in association with different movement in the body as in hand biting, kicking, pelvic thrusting, obstinance, arching posture, screaming or crying, talking during ictal phase. This episode is not associated with thumb biting, incontinence, or harmful fear or post-ictal confusion, and the patient mostly remember the event during this episode.
The feature distinguishing psychogenic or pseudo-seizure from seizure: when seizure onset is gradual and lasting more than 2 minutes, the eyes are closed, head moved side to side rather than fixed, limb movement are out of phase and asynchronous, the body in obstinance posture, not straight, with intense rotation in the bed. By definition of seizure, seizure is an excessive electrical activity of the brain. We can record it by an EEG. Then, for diagnosis of seizure, we are in need for confirmed by EEG record. EEG help in determine whether the episode is seizure and from where is the epilepsy is arised, either it is focal or generalized, and the type of seizure. It is difficult to take a EEG record during the seizure time, so the main record between the seizure and we call it an interictal record. The activity that confirming seizure ranging from spike or sharp wave, spike wave complex, multiple wave complex, and focal or diffuse background slowing.
Imaging studies for the brain, such as MRI or CT, are important to determine the structural abnormality as a cause of seizure and are indicated for all epilepsy, onset after the age of 16 years, and type of partial or focal seizure, focal neurological deficit or focal EEG finding, and intractable epilepsy.
To find the cause of seizure, we are need for investigate for systemic causes, so we are need for full biochemical and hematological investigation, including serum electrolyte. Serological tests are important to reveal the inflammatory and infective cause of seizure. Serum prolactin level and serum creatine kinase level will elevated following generalized tonic-clonic seizure, so it is important to differentiate between the real seizure from pseudo seizure. Serum level of anticonvulsant is important to test the compliance of epileptic patient. Chest X-ray and CSF examination are important to explore the infective and inflammatory causes of seizure.
First aid for the person with a seizure. Firstly, we must move the person away from the dangerous side, such as fire, water, machines, or furniture. After convulsion cessation, turn person into semi-prone position. Ensure airway is clear. Do not insert anything in the mouth, particularly your fingers. If convulsions continue for more than 5 minutes or recur without person regaining consciousness, manage as status epilepticus or call for emergency. Do not leave a person alone until fully recovered consciousness. Drowsy or confused person may harm himself, and this will take 30 minutes to 1 hour. When you are receiving a person with a convulsion in the emergency unit, we first ensure the ABC, secure intravenous access, send blood for glucose, urea, electrolyte, calcium, and magnesium, liver function test, and anti-epileptic drug level, full blood count and clotting screen, storing a sample for future analysis. If seizures continue for more than 5 minutes, give diazepam 10 mg IV or rectally, or lorazepam 4 mg IV. Repeat once only after 15 minutes. If no response, manage as status epilepticus. Correct any metabolic trigger or hyperthermia. Further management when the seizure subsides. For a single unprovoked seizure, no anticonvulsants are recommended. First, we must avoid the trigger factors such as alcohol and drug, sleep deprivation, recurring light, physical and mental exhaustion, infection, and metabolic disease. In single unprovoked seizure, Anticonvulsant indicated when there is only presence of focal neurological deficit or abnormal brain MRI, abnormal sleep-deprived EEG, partial onset seizure, presentation as status epilepticus, or there is presence of strong family history. When we encounter a patient with two unprovoked seizures, that means there is an epilepsy. Anticonvulsants are the mainstay of treatment. The function of anticonvulsant, either by increased inhibitory neurotransmission in the brain or alter neuron sodium channel to prevent abnormally rapid transmission of impulses. The goal of our treatment is to achieve a seizure-free state without adverse effect. Monotherapy and lowest dose is important because it decreases the likelihood of adverse effect and avoid drug interaction. The first line is sodium valproate and levetiracetam. Second line is lamotrigine, topiramate, and zonisamide. Third line is carbamazepine, phenytoin, brimidone, phenobarbital, and acetazolamide. While focal onset or secondary generalized tonic-clonic seizure, the first line choice is lamotrigine. Second line is carbamazepine, levetiracetam, sodium valproate, topiramate, zonisamide, and lacosamide. Third line is clobazam, gabapentin, oxcarbazine, phenobarbital, phenytoin, pregabalin, and brimidone. For the absent seizure, the first line is ethosuxamide, second line sodium valproate, third line lamotrigine, and clonazepam. Myoclonic seizure, first line is sodium valproate, second line levetiracetam and clonazepam, while third line is lamotrigine and phenobarbital. The guideline in the use of anticonvulsant therapy, we must use the first line drug, start at a low dose, use minimum number of doses per day. If the first choice is failed, we must select a second first line drug in combination to the previous choice and gradual withdrawal of the first choice. If the second drug also failed, start second line drug in combination with the first line drug. Preferred first line drug at maximum tolerated dose. Replace second line drug with alternative second line if also the combination is failed. If there is failure of also this step, we must check the compliance and reconsider diagnosis or consider the epilepsy surgery. A person with epilepsy may need for some lifestyle modification. Firstly, most of the epileptic person feel with stigmata. We must emphasize that epilepsy is a common disorder and they have 70% of full control by anti-epileptic medication. Patients with epilepsy should avoid some activities like swimming, fishing, or boating, driving, certain occupations, or working near machine or height. In using anticonvulsant medication, must consider the specification of some particular population, such as in children, the metabolization of the drug is faster, so they are in need to increase the number of doses per day, while in elderly, the metabolism is slower, and they are in need to reduce the dose and the number of doses per day. In women, birth control pills must be avoided in the use of carbamazepine, phenytoin, brimidone, and topiramate, oxcarbazepine, and phenobarbital. If epileptic women become pregnant, there is no change of the frequency or severity of epilepsy during their pregnancy period in 50% of them. In 25%, the frequency is increased, and in 25%, it is reduced. The pharmacokinetic effect of pregnancy: carbamazepine level may be felt in the third trimester and the need for increased dose. Lamotrigine and levetiracetam level may be felt early. The use of anticonvulsant medication with pregnancy may increase fetal risk of malformation. In normal population, around 2 to 3% have a baby with malformation. Women with anticonvulsant carry a 4 to 7% of risk of malformation. Lowest risk is by using carbamazepine, lamotrigine, and levetiracetam. Greater risk increase in polytherapy and with sodium valproate and topiramate. Malformation include neural tube defect, cleft palate, cleft lip, and heart defect. To reduce the risk for malformation, every epileptic woman must consult for full neurological evaluation prior to conception. Then switch to a lowest dose monotherapy and taking folic acid 5 mg daily 2 months before conception. Ultrasound examination must be performed at week 16 or 18 of gestation, and aminocentesis for alpha-fetoprotein test when there is a suspicion of malformation. To avoid the risk of newborn bleeding, the mother must take oral vitamin K 20 mg daily at the last month of pregnancy, and the infant must be received vitamin K 1 mg IM after birth. For lactating women, anticonvulsants are excreted in breast milk. There is no adverse effect have been attributed to these small amount of drug. Valproate is high protein bound and is absent in breast milk if it is useful in lactating women. In considering diet, small carbohydrate intake reset ketone metabolism for 2 weeks in children. So it is eliminating anticonvulsant efficacy in children with severe epilepsy. The use of anticonvulsant in need for long time. Discontinuation of anticonvulsants are indicated only when the person is seizure-free for at least 2 to 5 years, using monotherapy with normal sleep-deprived EEG, normal brain MRI, then anticonvulsant discontinue gradually over 6 to 12 months. Surgery may be indicated in specific situations in epilepsy. For example, vagus nerve stimulation is used for the medically refractory partial onset epilepsy in adults. Lobectomy and legionectomy is indicated in medically refractory partial onset epilepsy. Anticonvulsant indicated for patients with intractable atonic seizure.